Welcome back here at 10:30 on Live Impact News on WCNC Charlotte with the FIFA World Cup bringing soccer fans to Charlotte. Kids are getting out of school. They're heading to fields and courts across the region. Sports injuries are certainly top of mind for parents everywhere. And joining us now here on Live Impact News from Novant Health, Dr. Peyton Fennell, an orthopedic sports medicine physician and former team physician for the Carolina Hurricanes. Doctor, thanks for joining us this morning.
Thank you so much for having me.
So, Doctor, we're seeing a surge in youth sports activity this year, and with, FIFA, of course, people are talking about the game and very excited about that, but we're also talking about, these injuries. What is the most common type of injury when it comes to playing old soccer or football? And what are you seeing these days?
Sure. Well, to start off, sprains would be the most common injury. So a sprain is, it's the classic, I'm going to kick a soccer ball, I step a little funny, and my ankle kind of twists on me. That's the classic definition of what we call a sprain. Followed by sprains are usually things such as muscle injuries that can include some small micro tears all the way up to significant tears. And so with all that, it's an exciting time both for the athlete as well as what's going on in sports. And so I know from the orthopedic sports medicine side, when these sort of events start happening, we start gearing up and getting ready to go for that increase in demand that's going to be needed as people get out and play.
Yeah, and I know just being a golf fan, you watch the Masters and you're like, oh my God, I'm going to hit. I'm just going to go out there. And so watching all these rounds of soccer here the next couple of weeks, people are going to go and try things that maybe they shouldn't have any business doing. But how do you prevent these types of injuries? Is there even a way to prevent it?
Sure. There are always ways to try to prevent things. And right, so the most important thing is to realize that there are limitations to what you can do, right? If you haven't done a particular sport per se, let's say for a while, let's say you used to be a soccer player through high school, maybe at the collegiate level, but you haven't played in 20 years, to go out and do a pickup game, 90 minutes long is probably not in your best interest, right? And so that is one thing. On the side of the kids side, you mentioned that schools were out and, kids are going to be kids. And so the main advice I say with that is make sure that the kids are staying hydrated, make sure that they're eating properly throughout the summer as they go out and engage these activities.
All right, very good. Let's talk about concussions, a big convo piece, certainly a concern for parents. And so when someone's watching from the sidelines, what are the signs that they should look out for, and when should they pull their child from the game?
Sure. So concussions are a unique injury that obviously has had a lot of attention, I would say, over the last 20 years. And as we normally say, kind of in the business of concussions, no concussion is the same, right? So when somebody's had a concussion, let's say a teammate has had a concussion, and then somebody else, perhaps maybe has one, but maybe the teammate or even the coach might say, you know what, that doesn't look like concussion because that's different than what we've seen in the past. Just be aware that, because they are so different, people will manifest their symptoms, obviously strangely, right? So with that being said, the biggest marker that we look for when it comes to concussions are really two things. One, is there a mechanism that would be that you would be concerned about a concussion? Or two, how do they look overall, right? If I'm seeing a patient on the sideline and I say, I was worried about a specific injury, and the athlete comes over and I look at them, I might go to their athletic trainer, I might even go to their coach or their parent and be like, how is he looking to you? Does he look like you know him or her to be? That to me is kind of that first marker of, okay, it's time to be looked at, to be seen, to be evaluated by somebody who understands concussion medicine.
All right, very good. Knee injuries, certainly one of those things that seem to end a young athlete's career. What are the most common ones that you see, and are there warning signs before some serious knee injury happens, or is this just something over the course of time?
So knee injuries are the knee is a complex joint, right? It's that joint that just kind of sits out in the body. There's a lot of joints to the body, but this one in particular, especially with sports, quick bursts of speed, cutting that is required, particularly in soccer, puts the knee at risk. And so the most common things we see are usually are sprains or ligament tears. The most common one, if anybody watches sports, you hear typically of the ACL or the MCL. Those are kind of the big ones that are concern, but there are obviously other things that can take place. You can have, once again, injury to muscle. You can have what we call meniscus injuries as well. So as the knee is a complex joint, so can the injuries be.
All right. And there have been some major advancements so that recovery is not as long, yeah?
There has been. There are a lot of, medicine's always evolving, medicine's always changing. And so with that, what we do and what we try to keep up with is, your surgeon, your sports medicine doctors, we're always looking for, what is the fastest way that we can get them back onto the field, but safely. Right. And so this can be usually from a minimally invasive surgery to just rehabilitation. Right. It really just depends on the injury. The only way to know that is to be seen and evaluated. And so at Novant Health, we have what's called our Ortho Now, which is our urgent care that is 7 days a week across different locations across the Charlotte metro area. And so we're always here to be evaluated. Even, we're trying to save people from going to the emergency room for things that, they might sit in the emergency room for hours and hours and hours. We'd like to be able to get them in quickly, get them evaluated, and then get them on the right track to get back out there as quickly as possible.
Yeah, I was just going to ask you, when do you know to take someone to the ER? And I'm actually talking about, that sprain level. Like, can you do something at home without going to the ER?
You can do something at home. Typically, what we recommend is when it is an acute injury, something that just happened. If you can, let's say it's we'll go back to the knee. If you cannot bear weight, like you can't stand without even moving that knee, at that point, it's probably time to get seen. Pretty quickly, I would say within the next, couple hours or so, just because at that point it's usually a serious injury. Other things would be when you have significant swelling to an area, and then obviously, if kind of the one of the things that I always go after was if I hear the crowd go ooh, that's how I know that it's like that's something that could be something significant, or that's the sort of stuff we look for.
All right. Yeah, I'm always going ooh anyway, so it's so scary. And let's talk about the body's natural healing mechanisms. When should a player rest, and when should they push through?
Sure. So from a medical standpoint, the way that I look at this is that if you are acutely injured, you're right. Some injuries don't require anything other than just rest, right? So how do you know this? And so this is where, orthopedic urgent cares come in handy, right? It's a place where you can go. You can get that immediate evaluation to say, okay, look, we know that you're injured, but this is more of those that you're hurt, and not necessarily injured, right? So hurt means that you can kind of push through it, and then injured means no, you really have to step it back, otherwise you could be causing significant damage.
All right.
And so I think the level that you see when it comes to these orthopedic urgent cares that you don't get, particularly in the emergency department. It's not that they're not, they don't understand this. It's just that we see this on a day-to-day basis. That we can quickly evaluate and get players back because this is what we're used to.
Yeah. As a head physician for the Carolina Hurricanes, how has that informed you to treat, these young patients and kind of bring this everyday care to Novant?
Yeah, it's been, doing professional teams is a whole nother level, but, they all started somewhere, right? And they all started at the level where you see the amateur in whatever sport it is, right? And it's exciting to see them move forward. But, this is one of those things that a lot of the professionals get to these points knowing that they've probably been injured at some point along the way, right? So being able to trust your healthcare providers, to know that they have your best interest, that they're not that they're out there to get you back as safely and as quickly as possible.
And aren't you watching the games though, like right now, just going crazy?
That was a late night on
The other night, yeah.
overtime. I mean, it's tough knowing that I'm not necessarily a part of the team, but anymore since now that I moved to Charlotte. But it's been a tough watch.
Yeah, certainly they're in spirit, I know. Your top advice for parents then going into the summer, navigating some of the young ones who just are fearless and doing what they do?
Sure. What I usually tell parents is that let kids be kids, right? Like if they're a very young child, we don't need to be going to 5 or 6 different camps for the same sport during the summertime months, right? Like let's let them be kids, which means get out there, stay active. That is the biggest thing that we like to see. And that activity level, can help prevent injuries, because when you start spacing out sort of the kind of the activities you do, there's less chance of injury moving forward. So it's usually that. It's like, let kids be kids. Make sure they stay hydrated, particularly in the hottest parts of the day, and just be good parents.
Yeah. Yeah, that's a good one. Be good parents. Yeah, the overkill on the too many camps, one skill. It's kind of crazy for me. But anyway, Dr. Peyton Fennell, thank you so much. That was a great conversation. Appreciate the time.
Thank you so much.